Welcome to the She Is Her podcast. I'm your host, Gabby Richmond. The She Is Her podcast was created to give women voice as it relates to infertility, maternal health, and the birth experience. Hello and welcome to the She Is Her podcast. I'm your host, Gabby Richmond. The She Is Her podcast was created to give women a voice as it relates to infertility, maternal health, and the birth experience. My goal, my mission, my hope, my prayer is for women to be healed and heard through the podcast, through my guests, through their stories, and through their testimonies. And today we have a very special guest. I'm very excited to bring her on. Her name is Rachel St.Amor. Mrs. St.Amor is currently going through her cycles of IVF, and she is going through the transfer stage. I will allow her to share more about what that is, but her story is very amazing and inspiring. And so without further ado, Miss Rachel, how are you?
I'm good. Thank you so much for having me.
No problem.
That was such a wonderful introduction too. IVF can be really, really intimidating for a lot of women. So I'm very happy to be here to share what my husband and I have gone through, the highs, the lows, and there are both. And infertility is definitely something that impacts a lot of women. And I think we just don't get to hear about it enough.
Absolutely. And like I said, that's one of the reasons I wanted to do this, because I do feel like women suffer in silence. Oftentimes when you're on Facebook, and sit back, I want to make sure you relax. You relax.
Comfy, yes.
Touching the back of the.
Oh my God.
Are you touching the back of the seat?
Hold on, because my feet are not going to be on the ground anymore. Y'all are going to think I'm like a toddler, but we're going to do it.
Yes, let's relax. Let's. I'm sipping my Curaleaf's tea, one of our sponsors for this episode, just so you know. So I told everyone that you are currently in your cycles of IVF. Mm-hmm. But before we get to IVF, I want you to take me back to where this journey started. And you said, you and your husband said, we're ready to get pregnant. What was the first hurdle that you went through?
So my husband and I had the discussion that we wanted a family, but we weren't sure when we wanted to start. And then COVID hit, and it was our first wedding anniversary, which was May 4th. And we sat down and we said, okay, let's do this. This is going to be fine. I had an IUD in for years. So step one was get it out and see what happens. So we did, we walked into it thinking that we were going to be just like everyone else, that the IUD would come out, we would enjoy each other for a couple months, and then we would see those 2 lines on the pregnancy test, and then we'd be off on our way. But it didn't happen that way for us. So we made that decision. We decided we were ready. We had the IUD out. And in a few months when it wasn't working, we started going, okay, let's check to make sure I'm ovulating. And I wasn't at regular intervals. So by the time we got to January, we said, okay, it's been 6 months. I'm in my mid-30s. It's probably time to just make an appointment with our OBGYN.
So how many months was that from the time you started?
About 7 months.
7 months of trying, okay.
And they say that, like, I think when you're over 30, if you've been trying for more than 6 months with no positive results, see your doc. And it's a great idea. Love it. I was very saddened because my OBGYN retired during that time frame, and I went to someone new. And I had a really bad experience because they basically looked at me and said, well, if you haven't gotten pregnant by now, it's probably just not going to happen for you. We just consider you infertile at this point.
No.
Now, I don't think it was her fault. She had been a labor and delivery nurse, and she just transitioned over into like the office side of things. I think she was still learning, but that conversation will be emblazoned on my mind forever. So not so fun. But we didn't let it get us down, and she told us, like, just keep tracking your ovulation. We'll see what's going on. And we did, and ultimately, by the following summer, we were ready to say, okay, it's been more than a year. Let's actually go see a fertility clinic. And we started with, they ended up not being the best fit for us. They had some policies that I wasn't super thrilled with, but we went through the testing, we went through all of that. And ultimately we landed at the Delaware Institute for Reproductive Medicine up in Newark.
I remember you telling me that.
Yes, honestly, I don't want to sound like an advertisement for them, but they are angels there. They are amazing. They have been with me every single step of the way. They know you. They get to know who you are.
Shameless plug.
Shameless plug. Shameless. Absolutely. Like, not sponsored, but should be, because I love them. The doctors, the nurses, the PAs, everyone there is fantastic. And we said, well, look, let's get started. We did all the testing. They couldn't find anything that seemed like Wrong. Both of my fallopian tubes are open. My egg count was good. Uterine lining looked good. No endometriosis. None of the things that we would expect to see. So we said, let's give it a whirl. We'll do IUIs, which is intrauterine inseminations, where they basically time your ovulation. They give you drugs to help you through that. They take your husband's sperm, they wash it, they make sure that it looks good. They only put basically it's like a sperm concentrate that goes in. And hopefully that takes hold. For us, that didn't happen. So we did that 4 times.
Oh, wow.
And oh yeah.
Was that costly?
Insurance covers most of it. So you're kind of looking at like your co-pays and such. There wasn't anything that really jumped out as like massively expensive. It's nowhere near as expensive as doing IVF. However, one thing that I do like about IVF and fertility treatments now here in Maryland, and I can't speak for other states, but it is now part of the law in Maryland that if employers offer insurance, they do have to cover some pieces of fertility treatment, which I think is very cool.
Okay, I didn't know that.
It's a neat fact to know. It's just something to keep in the back of your mind because infertility affects about 1 in 8 women. So it's a huge statistic, and knowing that you have some kind of care. Now, not all insurance is created equal. I can't speak for any of that, but we were very, very grateful that our insurance covered all of our cycles. Now, again, like the drugs and things, are always extra that go along with it. And when those didn't work, we said, okay, let's step it up. Let's do it. Let's do the IVF. And we started that. We started our first cycle of that actually just about a year ago. We started our injections and the process there. Yeah. And so we've been in IVF for a year.
Okay. So for those who don't know, how does IVF start? Like, what does that even mean? What do I do first if I want to do IVF?
Oh my gosh. And I am, just to preface this, not a nurse, not a doctor, but I'll tell you what I went through for sure. So they're going to make sure that your uterine lining looks good. They'll check your blood work to make sure where you're at in your cycle. And then you go into what's called the stimulation phase or the stimulation cycle. They use those interchangeably. And that's where you're essentially taking your ovaries and putting them into overdrive, because normally, obviously in our cycles, we mature 1, sometimes 2 eggs to be released, and that's normal. We are looking for about 20.
Wow.
Mm-hmm. So in order to do that, you take a certain amount of medications. They're typically injections. And the injections, there's usually 1 or 2 in the morning, 1 or 2 at night, and sometimes there's over-the-counter medication that goes along with it just to help with pain and such. Truthfully, that part is not bad at all. They are the teeny tiniest little needles in the world, and it's not too bad. It's uncomfortable. People liken it a little bit to being in your first trimester because you are taking something that's the size of a ping pong ball or a golf ball and going to softball size, just because you're developing all of these follicles. So that's the real first piece of it. And this is the reason that I say that find a fertility clinic that you love. Like, if you are not excited about your fertility clinic, advocate for yourself and find one that you are, because you are up there all the time. They are taking blood work. They are taking ultrasounds. They are doing everything to make sure that you are on your way.
Right.
So when you walk into your office, you should feel like these people have my back. I know that they have my best interest at heart.
Which is important. I just want to
important.
interject for a second. That's important in general, whether it be your OBGYN, whether you're doing IVF, anything, to connect with your doctor, because at the end of the day, this is your health. Mm-hmm. And so if you're treated like a number, they can miss something really big, mm-hmm. or you could miss out on something really big in life because of the lack of knowledge or care from whose arms you're in.
100%, yes. I couldn't agree more. And knowing that there's someone out there that you walk in the room and they're not checking your chart to see what your name is. And not only do they know you, but they're like, all right, so the last time I saw you, we saw that we had 8 little follicles that were going, let's see where we are today. They measure them, they're there, and they're the ones that are giving you good and bad news as you go through it. So you get the scans, and when your follicles get to be the size that they're looking for, I wish I had more information on exactly what that is, but it is what it is. Then you go through the egg retrieval process. You take one last shot. They call it the trigger shot. For me, it was Ovidrel. There's a couple other options. And then you go in for the procedure. They take all the little eggs out. They put you under a little bit of twilight anesthesia. So that's the one real time that you have any anesthesia that's going on. But no pain, nothing too crazy. And then you kind of take it easy for the rest of the day and rest and relax while they do the hard stuff. Once they have the eggs, and they'll check all of them, see what's mature, see which ones look good. That's when they get fertilized.
How do they do it? I can't remember the term, but do they go through the vagina or to retrieve them?
They do. Yep, they go in through the vagina. They have a scope that goes up, and then they're just kind of pulled out in a syringe, essentially.
Oh, cool.
And it's really cool. Honestly, I wish I could like go back and see what the procedure looks like, because they are so tiny. I mean, the eggs are like little teeny tiny specks, and so it's a neat thing that I really wish that I could have seen as it was happening. But again, knowing that you're in the good hands of a team that you really love, like, you know that they are doing the best for you. And then they start cooking the little embryos. They go into their incubators. They let you know, typically like on day 1 or 2, this is how many you have, this is how many are growing, these are the ones that look good. And ultimately what you want is those embryos to get to what's called the blastocyst stage. And that's where it kind of starts to separate. It's a very distinct look of what the embryo is. And they'll let you know on day 5, and sometimes, don't panic, because I panicked on day 5 when they told me the first time. They're like, you only have 2 that have reached blastocyst, but we're gonna let them keep growing another day. So they let them grow to day 6, and by that time we had 4. So it's definitely a whole lot to consider. And when they did our first egg retrieval, we had 16 eggs, and of those, I believe 8 were mature and 4 made it all the way to blastocyst. So it's really hard to watch those numbers go down, though, because you're going, I just want all of them. I want all of them to be there. Even though you know it only takes 1, you still want the best chances that you have, right? And then they get frozen. Then they get frozen until you're ready. There are some IVF clinics that will do them fresh, where they wait until day 3 or day 5, and then they'll do a transfer right then and there. But my clinic takes the approach of freezing and then doing what they call an FET, or a frozen embryo transfer.
So what do you do in that between time when they're frozen?
A lot of different options. Some people just kind of wait, let their body reset, take a deep breath.
Like, give me a second.
Yeah, like, let my body reset.
So no medication during that time, no shots?
No shots. Oh my God. Nope. They just want your body to reset. You'll have a period because you've just released all of those eggs, and it feels like a mega period a little bit. But oh my God, not my favorite one, but at least it was for me. And the very first time, I will say, so we've had 2 of these stimulation cycles, and our first one, I did have a complication. And it's a complication. It's not common. It is not a common thing, but we all have things that happen that are outside the scope of what we're expecting, right? And that was called OHSS, which is ovarian hyperstimulation syndrome. And what happens there is...
I remember, yeah.
Yeah, so it's where your ovaries that you've already put into overdrive don't realize that they're supposed to stop being in overdrive, and they kick it up, they spinal tap it and turn it to 11, basically. But fortunately, again, my doc came in, he gave us his personal cell phone number to reach out to after hours in case we had any issues, made sure we had the right medications to help bring it down. It was a really, really rough day or 2 on that one.
That's just pain or just cramping?
Pain. Pain, cramping. Honestly, it felt kind of like I had my appendix out when I was 18. It reminded me of having appendicitis, where you're going like, do I go to the hospital? Should I go to the hospital? Fortunately for me, I didn't have to. They were able to treat me right away, and they could do everything from home, which was great. But anyway, back to the in-between time. Your body just resets. You kind of get to go back to baseline. There are some clinics, and mine offered it as an option to do what they call a mock cycle, which is to essentially see how your body will react to the medications that you're going to go on during the transfer cycle. So they'll put you on the estradiol, which is also called estrace, and they kind of track your body and see how it's doing. How's your uterine lining thickening? How is this going? You also have the option to have a biopsy done of your uterine lining, just to make sure that you have the right microbiome in there, that there's no bacteria that got in, there's nothing that's causing any issues. There are things that can cause chronic endometritis, which is just an inflammation, and they want to get all of that resolved.
You sound like a specialist. You are a specialist.
Oh my God, I try.
You're a specialist.
I'm a researcher. That's it. I want to know everything that there is to know so I can make the best choices for me.
Right.
And we did opt to do the biopsies. not a fun one. It is not one that I'm signing up to do like literally ever again, but 100% worth it to do. We got some great information. We did actually find that I had some inflammation that needed to be treated. So they treated it. We were able to know for sure that when they put an embryo in there, it was the happiest, coziest little home that an embryo could possibly imagine. And so we had our egg retrieval was in late April, early May of last year. And we ended up waiting until August to do a transfer cycle, just to give my body enough time to heal, to do that treatment that was needed. And we had a really disappointing first transfer cycle. We chose to send our embryos off for genetic testing, which is totally optional. And I will not lie to you, that is the most expensive thing that we had to deal with throughout IVF because insurance does not cover it. Doesn't cover it in any way, shape, or form because it's considered elective. But what they do is before they freeze the embryos, they take a very small biopsy, they send them out, and they check all of the chromosomes to make sure that they're lining up. We found that to be very, very helpful for us. It has a 98% accuracy reading. So you know for sure that you're not putting in an embryo that wouldn't survive anyway. That also let us go saying instead of putting in, sometimes you'll hear with IVF, twins, triplets, quadruplets, because they're putting in more than one embryo at a time, not knowing if they're genetically sound. So we could say, let's put in one embryo at a time. Ultimately, by the end of it, we had 2. And when we went in for our transfer, it was really hard that day. The chance of survival of the thaw is 98%. So there's only a 2% chance that your embryo doesn't make it. When we went in for our transfer, our best quality embryo didn't survive the thaw. So we only had 1 shot. We had 1 shot to get it right, and unfortunately it didn't take, which was really hard. That was probably the hardest phone call that I think we had to take. We thought, like, this is it. We're in the home stretch. We did it. We did everything right. All of the readings looked the way that they should have. My levels were looking good. My doc was like, your uterine lining is amazing. This is exactly what we want to see. So we walked out so hopeful. And the day that we got the call, it was really, really hard.
What conclusion did you draw from that? Did you say something like, just must not be meant to be, or it's not meant for me? Or were you like, I'm gonna cry and we're gonna pick ourselves up? What was the reaction after that?
I wish that I was as graceful as being able to say this one just wasn't meant to be, but I went, all right, we're gonna do this. I'm gonna cry about it, and then I'm gonna boss up and move on and do it. But first, we had our good cry. We were very sad. And it was also hard because when you do genetic testing, you have the option of finding out what the sex is too. And we knew that it was a little boy. So it was very hard to let go of the fact that
Right.
I would have a son and my son was going to be here and I could see his due date. I could see us starting to pick out names. Like I could visualize it, and letting go of those images is probably the hardest part. And then we said, okay, you know what? We're going to do it again, and we're going to do the stimulation cycle again. My husband supported me through all of it. He said, what do you want to do? At any point in time, if I would have said, honey, I love you, but I'm done, I can't do this anymore, he would have said, okay, that's no problem. We have always said that between the two of us, we are a complete family. We're a complete family, just he and I. But we always said we're complete but not finished. So we're working on finishing.
That. Yeah, I like that.
And we would have jumped straight into adoption at any point too. But another interesting wrinkle of COVID is that adoption slowed down. You know, people aren't out at clubs making one-night stand decisions. Teenagers aren't being left home alone after school. That there weren't that many children available for adoption. It's crazy, right? And we were being told like 5-year waiting times. The international adoptions closed because
I was not expecting you to say that.
But it's true. It's so crazy. So we said, okay, you know what? Adoption seems too far let down the line. I have it in me to do it again. And he said, if you can do it, I can do it. If you can do it, I'll support you through it. And I am truly married to a saint. He puts the saint in our last name.
Yes.
And I am so, so grateful for his existence in the world and in my life. I could not do it without him. But we said, let's go. And he said, do you want to wait? Do you want to take time? And I said, absolutely not. Let's go. So starting in October, we started it again. We went through it. We did the stimulation.
So how many months after you got the bad news did you decide to start again? Well, did you start again?
we were kind of at the mercy of like the cycles that the clinic run on, because they'll kind of keep you so that you're all going together, which makes so much sense for the clinic. It means that they can see more women. So I love that. I'm like, if I've got to be in a holding pattern for a couple weeks, I'm good with it. So we told our clinic, like the day they told us that it hadn't worked, that we were ready to go again. So within 6 weeks, we were rolling again.
So you didn't even have like a lot of time to mope or second guess, or right? I love that.
No, I feel like it's time. I don't want to say I'm not getting any younger, but
Hey, so time is also of the essence.
That's it. And fertility is not what it was 20 years ago, where if you turn 35 and they're calling you a geriatric pregnancy and you're going like, oh my God, I'm not that old, I swear. It's not the same, which is a really, really good news, right? It's good to know that more women are getting pregnant later, but at the same time, you still have that voice that you've heard in your head ever since you start trying to get pregnant, that you hit 35 and everything just goes downhill. So we said, let's do it. Forget it. It's never going to get any easier. So why wait? Let's just do it. And I'm grateful that we did. We ended up with 3 genetically sound embryos. They were all grade A or A+, so we have our little valedictorian in there. And we are currently in our 2-week wait to see if this transfer cycle worked.
Wow.
So I should be getting good news hopefully soon.
That is so freaking exciting. I'm so happy for you. I know it's going to happen. Like, I want to be at the baby shower. Like,
oh my God, you have to be, yes.
Oh my God, because I just have that faith that I just know that like, if anybody puts themselves out there in that manner with so much courage and hope, there's no way you can fail. That's just kind of how I think. I'm like, God's not gonna let you down. Like you put so much on the table.
If you bring everything that you have and you are willing to do the hard things, it will work out. That's the thing, is if you look at the numbers, I'm a numbers and statistics person, hands down. That's just who I am as a human being. And if you look at it, it says it's there. It says it's there. And if you do it and you put in the work and you are not afraid to feel like you're in your first trimester for 6 months, which is kind of what they tell you feel like, then you can do it. You can do it. Women are built to do hard things. And this is just one more hard thing.
Yeah. I had another question. I am a firm believer of holistic healing, right? And so one thing I actually know from my personal experiences or friends who talk to me is if you go and you tell the doctor, or they diagnose you with something, right? Say you have fibroids, cysts, PCOS. One thing I learned in my research and on this journey was that, a food change, changing your diet could actually heal you and make all the difference. So I'm going to ask you, did anybody ask you what you were eating or about diet or suggest you to change your diet?
They talked to me about it, and realistically, my husband and I are fish people, we're vegetable people, we're fruit people. So it wasn't a huge change for us in any way. We did try some other alternative medicine things. I did acupuncture. Truthfully, I've never slept better than when I have acupuncture. So love that for everything.
I've heard that many times, so I'm going to try that.
And they do things with like circulation and such. And I do have PCOS as well. So that is another kind of wrinkle in the things for fertility for me as well, knowing that I don't ovulate regularly. I do have cysts regularly. So
but that was the reason, like at the end, that was the reason why they deemed you infertile, right?
Correct.
Because of the PCOS. Exactly.
And I think that the nurse, the one that told me that, oh, you're infertile, it'll never happen for you, I think she was just looking at PCOS going, well, that's just the way that it is for most of those women. You don't ovulate regularly, so even if you're having intercourse at exactly the perfect time, it won't matter because there's no egg there. And the one blessing that I can say is if you are a woman with PCOS, probably means your egg reserves are fantastic. You have more eggs because you don't ovulate them every month.
You don't release them.
That's it. So I still had high quality eggs in there. So in a roundabout kind of way, I'm grateful for my body for doing those things.
Absolutely. I just wanted to ask that because I'm always just curious. Like I said, I have some friends who share their experiences. I do research. It's like my thing that, I'm always doing research. But I just wanted to ask that question too. And so fast forward, here we are now.
Here we are.
We're waiting. My next question would be, what was the one time where you maybe felt unheard throughout this whole process?
That was when I decided to stop going to, and I don't want to throw anyone under the bus. I know that they have been wildly successful. There's a reason that they have locations everywhere. There's a reason that they see so many patients. But I felt so underwhelmed there because I didn't have access to a consistent person. They assign you to basically a patient care coordinator that makes sure that you get your HSG done, that you get these things done, and you have these things that go on. But you never really had access to your doctor. It was like pulling teeth to even have a discussion with them, to get them on a video call. I never met my doctor in person ever. I could only ever talk to them via video call. And it just felt like I was just another number to them. No one knew who you were. It didn't feel like the right place for me. And there are plenty of women that would have just gone, well, I guess that's the way everyone is. Also won't treat women who are overweight, which is kind of an interesting piece that they don't tell you up front until you're ready to do your first IUI and they go, oh, your BMI is too high. Well, that would have been helpful information 3 months ago when I could have started doing something more about that. So that was a moment of going, you've got to be kidding me.
But there's so many other options.
Yeah.
There are. I drive 45 minutes
to my doctor, and there's times that I'm doing it 2 and 3 times a week. And is it so much more inconvenient than just driving down the road? Yes, but it's worth it. When I walk into the waiting room, there are lots of other women who look like me, who clearly have PCOS, who clearly have these other issues. And when we went through and did the research, we found that there's no reason to not treat women who are overweight. There's no reason for it. It just means that your success rates are frequently lower. And it seems like people want to stack the deck and make it seem like, well, our success rates are so much higher. Well, when you pick and choose your patients, that can happen. But then I go into my clinic and I see women walking out with ultrasound pictures because they're pregnant and they look like me. They have similar body types to me. And it's like, well, if they can work for her, it'll work for me. And that was one of my first questions for the fertility clinic is there a BMI that you won't work with? And they said, absolutely not. We treat everyone. We believe that this is for everyone. Motherhood is for everyone. And that is an incredibly empowering thing. But I do know many women out there that would have heard that from and gone, oh my God, well, I guess I'll come back to it in 3 years after I figured out how to lose 10, 20, 60, 80 pounds, just to see where you are. But there are doctors that will meet you where you are. You don't have to fit into the mold of where they are.
Right. We can't say it enough. That's really important. You almost have to just be the leader of your own life and understand that you can't trust the first source, maybe not the second source. So you literally have to go with who you feel in your gut. Mm-hmm. But in addition to that, who's taking the time who accepts you, mm-hmm. who hears you, right? She is heard. Who do you feel heard by? So.
And that's it, is even when I talked to that doctor before my current clinic, I never felt like they were listening to me. I didn't feel heard. And when I see my doctors, when I see my nurses, they notice when I get bangs, for goodness sake. They notice like all of the little things. And it's like, that's what I want. I want to come in.
Notice me, like, right.
Yes. They know what I do for a living and they go, oh my God, I just bought a new couch. Can I show it to you? Do you think it looks good? I'm thinking about buying a new chair for my dining room table. Do you think this color works? And yes, we can talk about that in my appointment because it means that you know me. You remember my husband's name, even though he's not always at every appointment. Most of the time, your partners are not necessarily with you. But they still know, they still care, and they are so involved, and just know that if you keep pushing and advocating for yourself, you will find the right team. It will happen. It will.
Yeah, it's possible.
Absolutely.
It's wholeheartedly possible, whether you go IVF route, whether you just say, I want to try holistic healing, I want to try some teas, I want to see if there's hope. And I mean, there's so many arenas and areas and solutions out here. You just have to be kind of open to hearing about them and trying them. And so I wanted to also mention this when you were talking about what you do. Rachel's home is beautiful. This is not a set. This this is her front room. So yeah, when I was thinking about doing the podcast, I was like, I want this to feel like homey. I want the women to feel comfortable, like a conversation we're having on the couch, having some tea, girl talk. In other spaces, maybe wine,
Yes.
But I don't know. I just, when we talked and you agreed to be on the show, I was like, I didn't want to say it, but I was like, I know she got a good place. I know her home look good. Like, her home is perfect for the podcast.
Oh my gosh, you're so funny. Thank you. No, I love getting to design spaces. It makes me feel happy. And when my husband and I worked on our house together, and we did all of this together, the paint, the wallpaper, the pictures, if it's up here, we did it ourselves. And that's been our approach to everything and to life in general is we can do it all as long as we do it together.
I love it. I wish she was here. I would be like, come on, camera.
I know. Oh my gosh. He actually went to the office today. The audacity of that man.
It's fine. But yeah, I'm really grateful. I'm honored. Have you shared your story publicly?
No. We tend to be more private with certain things, and there's no reason for it, but I think a lot of it is just sometimes, and I think we all see it on social media where there's that person that's always like the woe is me person, and you're like, I don't want to be that one. I want to be someone that's positive and that sends out a good message, but the grief that you feel when you get another it didn't work answer is something that I process better on my own, and or with people just like this, that we can have this conversation, and even knowing that there will be many, many other people listening to this podcast later, it still feels like they're a part of the conversation, and it's not just listening to the result, but knowing what the everyday is. I kept a journal of things as we were going through, because I know that even the blogs that are out there are going, well, some women feel this. And if you ask Google, what is IVF like? It varies from woman to woman. And there's no personal interaction with it. But I didn't want everyone to feel like it was attention seeking.
Wow.
So I just wanted to have my support, know what's going on. And I'm so, so blessed to have a family that gets it, friends that get it. They always check in on us. They know what we're going through, and we share that with them. But I wasn't ready I didn't want there to be anyone out there going, she just wants the attention from this.
Really? So I would think it would be more so along the lines of, I don't want to jinx it. Like, this is so precious and it's happening so now. And that's why I'm saying I'm so honored, because when I came, I was like, oh, I think she's pregnant. I have no I don't have a true understanding of every aspect of IVF because it's so long, right? Until you go through it is when you start to understand. But I'm like, I think she's going to be pregnant, but it's so precious. And that's why I feel so honored that you would come on while you're in the process.
But I think it's important to talk about it while you're in the process. That, there are a lot of women that I do see that talk about it, and it's almost harder to hear about fertility from someone that's holding a healthy baby.
Yes.
Because you're going, it's done for you. It's a lot easier in hindsight to go, well, yeah, of course you should keep going through it, because this is what you'll be left with at the end, is this wonderful, healthy baby. But that isn't true for every woman. And while I hope that that's my ending point, and my husband and I live in a world of hope, that we've started working on a nursery, knowing that our baby's coming. Our baby will be there eventually. And there are people that would look at it and go, you're starting on a nursery already, but you're not even pregnant. Well, I will be. It will eventually happen for me. So being able to talk about fertility while you're in it feels so impactful and so hopeful to say,
absolutely,
I know it's coming for me.
So much more relatable.
It's very hard to watch someone with a beautiful baby bouncing on their hip telling you that it's all going to be okay, when that's how it worked for them.
This brings me to my last question. What would you say to women who are aspiring to go and take the route that you and your husband took, but they may have apprehension or some doubt with starting the journey?
That it's okay to have doubt. I question it still. My husband and I have said, well, if this one doesn't work, would we do it a third time? And there's still questions that I don't have an answer for, that maybe we will, maybe we would take a break, but give yourself grace and give yourself the ability to be where you are. that not every day are you going to feel like the woman in the yogurt commercial going, everything's better and life is great. You're not going to feel that way every day. You will have days where you feel like, am I even a real woman if I can't have a baby naturally? And even though I know that's not true in my heart of hearts, that I know that it doesn't matter how you become a mother. There's still those stigmas that will creep into you, but don't be afraid and give yourself the time you need. Make yourself ask the uncomfortable questions. Make yourself do the things that you don't think you can do, because you can. You can do them. You can get through it. There are things that will be harder than you could possibly imagine, but the journey is worth it. Even knowing that my journey's not over and I don't have that beautiful baby sitting on my lap here today, I still know that it was worth it. My marriage is stronger. My husband I'm going to tear up talking about this because he is stronger than I ever could have imagined. I have leaned on him for so many things, but lean on your partner, get them involved, but don't give up, because you can do it. You can do it. Women are built to do hard things. We go into labor. We do all of these things. We menstruate every month. All of these are hard things. We can do hard things, and so can you. Everyone can. We can do this.
You can do it. And the support is so important. You're right.
But the other side too is, if you get to the point where you don't want to do it anymore, that it's okay. It's okay to set the burden down. It's okay to find another way to be a mom. It's okay to adopt. It's okay to foster. It's okay to just be someone's really, really, really cool aunt. That's what I've been for the last several years, and I love it. I wouldn't trade it for anything, but just know that motherhood can happen to you in any way, and it's all worth it.
Absolutely.
It'll get
Rachel, thanks for coming on the show.
Thank you for having me.
Of course, thank you. I've been telling you about this for like almost a year. So now almost. So, yeah, I really appreciate you again. I'm happy for you in advance.
Thank you.
And I'm proud of you now, regardless of what happens, even though I know it's going to happen for you. I'm just so proud of you.
Thank you.
It takes something.
It does. It definitely does. And thank you for inviting me on, letting me share these things. I'm so grateful to have the opportunity to share a big picture of the story. Like I said, not sharing post here, post there, post here, post there, to go, this is what it is in its rawest form. And thank you for giving me the outlet to do that.
No problem. Do you feel heard?
I do. Thank you for letting me be heard.
No problem. All right, everyone. Ladies, gents, whoever is watching, I hope you all enjoyed the podcast today. I hope you learned something. I hope you enjoyed my guest, Miss Rachel, and I hope you felt heard. And if you have a story, if you have a testimony, if you have a unique story, I should say, or if you're an expert in any area related to infertility, maternal health, or the birth experience, please email we're going to put it right here. Just please email this email, and I will definitely be reaching out to you to hear your story and hopefully get you sitting right next to me as well. So thank you. We love you, and bye-bye. Update. She's pregnant. Yay. Miss Rachel is pregnant. This is her ultrasound. She is expecting a precious baby girl November of this year, 2023. Do me a favor and congratulate her in the comments. Yes, we are so proud of her. What a way to end the very first episode. I love it. See you guys on the next one.